Obama brought us the American Care Act, and Donald Trump had no plans other than to repeal Obamacare. So do you believe that Trump had a better plan than the Democrats?
I'm sorry. Can you? I just want to make one correction. I think you said American Care Act. I think you mean Affordable Care Act.
Sorry, yes.
No, you're fine. Okay, so this is a little more complicated. Obviously Donald Trump did have a healthcare bill that was completely awful. I don't have the statistics. I forget what it's called, but it got the name Trump Care, and he said he endorsed that plan. And it was abysmal. But like as far as like that compared to that plan or no plan at all, I think the Affordable Care Act was wildly inadequate, and I think it was a massive giveaway to the private insurance industry, in the sense that not only did it keep private insurance companies intact, but when you implement a policy that isn't a universally beneficial program, it's a lot easier to repeal that and attack it, especially if it's already not a perfect bill, in the sense that it does certain parts of it expire. There is the individual mandate, which states that if you don't have health care, then you basically pay a penalty tax. I think the Affordable Care Act, if there were no opposition ever, would have been better than what we had. But because it was so wildly inadequate, because it was, I guess you'd call it incrementalism, and not a universal program, it's a lot easier to repeal. The Affordable Care Act was at any given time only had like 50% support, 50%. It was like split down the middle. And so when you don't have a full amount of support for a policy, it's a lot easier to attack and destroy that policy, as Trump effectively did through executive orders, where he didn't get rid of the Affordable Care Act, but he stripped it down so much that it was effectively non-existent in the way that it functions. It's when you strip everything away from it, now it doesn't function as it's supposed to, and it'll eventually collapse in on itself. Now, the reason why I say that might not even be, I would rather not that at all. I mean, it's better that more people are covered, but then like because of Obamacare, because of the Affordable Care Act, premiums and deductibles skyrocketed. But the reason I would say that's still not an efficient policy, and even the public option, which I think is like a step up from even that, is still not an effective policy, is because when you don't implement the universal policy, it leaves it open to be easily attacked. Already it's not great. 50% of the American people are not in favor of it. Only 50% of it are. But I think ultimately a universal program benefits everybody. So like, let's say you implemented Medicare-For-All. Now everybody has free at the point of service, cheap, affordable, good quality healthcare. And when I say affordable, I mean through their tax dollars. Like they'll save money through their tax dollars than what they would have spent on private insurance if they would have been able to afford private insurance at all. So when you give everybody free at the point of service healthcare, now everybody's benefiting off of it. Everybody has healthcare. Everybody can feel in their personal lives how that policy benefits them. The Affordable Care Act doesn't do that. The public options problem is that people go, well, the public option would be a good first incremental step. And although I think I'm split on that, because the problem I have with the public option is that what it does is it has like this two-tiered system where the rich will all be on their private health insurance and all of the poor will be just shoved onto the public option, and it won't have the funding to deal with that overload of people who are sick and on that system. And so what you'll get is this massively collapsed system of the public option because it can't afford all of, like, you know, you don't have, if everybody's opt into Medicare for all, then the wealthy are helping to sustain it. And in addition to that, if the wealthy have that same healthcare that everybody else has, they will do their best to make sure that that healthcare is S tier, is good quality healthcare, because that's the same healthcare they have to use. So of course they want it to be good. But when you have a public option, you'll have the rich won't give a shit about the public option. They'll stick to their private insurance, and you know, you'll have the rich on this really good quality private insurance, and then you'll have this degraded, rundown public health insurance that everyone who can't afford private insurance is gonna go on. So you'll have all the sick and the poor on all the sick on the public option, and all the rich on and it'll financially collapse the system. And then the Republicans will use that as the talking point to say, see, socialized medicine doesn't work. See, Medicare, like your universal healthcare system, you tried it and it failed. And then that stops the conversation for Medicare for all in the future, because the public option or the Affordable Care Act or any of the inadequate healthcare systems will not do the job they need to do in order to effectively give everybody the good quality, affordable healthcare that they need. And when I say, like, again, when I say affordable, I mean affordable through their tax dollars, not affordable as in like affordable private insurance. I mean affordable through their tax dollars, so that they pay, like, it comes out of their taxes, and when they go to the doctor, that is free at the point of service. That's the, like, I'm not, you know, some people will say affordable, and that's just a weasel. That's normally a weasel word for, I want everyone to have affordable health care. When you hear neoliberal Democrats say that, that is just that's secret term for, I want private insurance, and this is my way of selling it to my otherwise progressive base.
Absolutely. And something I want to point out, you make a lot of great points. So I want to point out is universal health care is so popular in other countries that even the conservatives run on it.
Yeah, no, that's oh my God, that's such a good point. I can't even believe I missed that. So every other modern nation on the face of the planet has one version or another of single payer healthcare. The only exception is the United States. And there's been multiple studies that Medicare for all would actually save the American people money. There's been a University of Massachusetts Amherst study. There's a Yale study. There's a multitude of different studies that show over the next 10 years, Medicare for all would save us $5 trillion. In fact, according to the most conservative study, a study funded by the Koch brothers, the Markina Institute study, under the worst case scenario, when they're like over bloating budgets and adding numbers that shouldn't be added, even in that worst case conservative scenario, Medicare for all over the next 10 years still saves $2 trillion. So in the worst case scenario, you're saving $2 trillion. In the most accurate scenario, you're saving $5 or more trillion. Like that has been proven. That's a fact by multiple peer-reviewed studies. And so, like you said, every modern nation on the face of the planet has one version or another of single-payer healthcare, and all, like, both on the right and the left, they can't touch that. Not even their conservative, not even their right-wing politicians can dare speak out against their universal healthcare system, because that is the power of a universal program. It's like Social Security here. Like, you can't get rid of universal programs. They're too popular. You'll never be taken seriously ever again if you even speak one bad word about universal programs, even here. I mean, there's a reason why nobody speaks out about Social Security here, because they know they'll get eaten alive and they'll never have a job again in politics, or at least in political office. And so not only would a universal healthcare program Medicare for all in this country save us trillions of dollars, save the American people trillions of dollars. But in those same studies, compared to other countries, in many of those studies, compared to the other countries that have the single payer healthcare, as you pointed out, they get better quality care, better results, better outcomes, and they have the added benefit of covering every man, woman, and child in the entire country. Universal healthcare, and specifically the Bernie Sanders bill of Medicare for all, is objectively better in every measurable category when compared to our current for-profit private health insurance system. It's just a fact. It's just a fact. I honestly believe that if anybody argues against Medicare for all at this point, they are one of two things. They are purposely trying to push misinformation, because they're bad faith actors, and maybe they work in the establishment and they profit from the corruption that the financial corruption, the money that comes from pharmaceutical companies, the private insurance, pharmaceutical companies, private insurance companies, the healthcare industry as a whole, or they're just ignorant on the issue. And when you bring up a lot of this stuff, this is why Medicare for all is so massively popular, even with the massive campaign here in the United States to discredit it. The Marcana Institute study was an attempt to discredit it, and even that showed it looked good. And when you have all of this, Fox News and even MSNBC and CNN and all the mainstream, the Washington Post, all of the mainstream news outlets discrediting Medicare for all, it's still, some polls show it's got 70% approval, 80, 90 something percent Democratic approval, even majority of Republican approval on this policy. And even at its lowest, I think it has a 60 something percent overall approval rating. And that is because it's just it's the easiest to argue for, because you have these, as I'm just stating, all of these facts, that it saves money, it's better quality care, covers everybody, you get all of these different things. It's an easy argument to make for it because there's no objective downsides, none at all. So that's why the majority of the American people, even in the face of smears for this policy, still support it.